Managing a patient's airway is a fundamental life-saving skill, one that both basic and advanced healthcare providers should be able to perform well. Welcome to the American Heart Association's Airway Management video. Airway management is one of the key interventions in the BLS and ACLS surveys. How you manage the airway depends on your training, abilities, and scope of practice. The optimal method of managing the airway will vary based on provider experience, EMS or healthcare system characteristics, and the patient's condition. The skills you will practice in this section of the course are essential to complete the ACLS case scenarios and testing. We'll review and practice effective bag mask ventilation in both single rescuer and two rescuer scenarios. We'll review the steps in responding to a respiratory arrest and the recommended use of waveform capnography to monitor and confirm the placement of an endotracheal tube. Before we get into the specific airway skills, let's review the recommended ventilation rate for cardiac arrest patients. Ventilations and compressions are important for patients with prolonged ventricular fibrillation, or VF, cardiac arrest, and for all patients with other presenting rhythms. But in the first few minutes of a VF cardiac arrest, rescue breaths are not as important as chest compressions. That's because the blood oxygen content remains adequate for the first several minutes after the onset of VF, regardless of whether the patient receives assisted ventilation. As the arrest persists, replenishing oxygen and eliminating excess carbon dioxide becomes more important. This is also true for cases involving drowning or other instances where hypoxia is the likely cause of the cardiac arrest. The American Heart Association recommends that during BLS, healthcare providers deliver 2 ventilations after every 30 compressions. Providers should not interrupt chest compressions for longer than 10 seconds to deliver these breaths. After inserting an advanced airway, providers should deliver 1 breath every 6 to 8 seconds, or 8 to 10 breaths a minute while chest compressions continue uninterrupted. If a patient is in respiratory arrest and has a pulse but is not breathing, give 1 breath every 5 to 6 seconds, or 10 to 12 breaths per minute. After 2 minutes, reassess the pulse. For arrest patients, tidal volume should be approximately 600 milliliters, enough to see visible chest rise. This is about half a squeeze of an adult ventilation bag. Providers should avoid administering tidal volumes that are too large or providing excessive ventilation. Not only can this cause gastric inflation and the resulting complications, but excessive ventilation increases intrathoracic pressure, decreases venous return to the heart, and lowers cardiac output and the patient's chance of survival. The skills you learn in this section of the course are critical to patient survival rates, especially in persistent cardiac arrest situations.